Hello everyone. Today we are going to discuss an important topic in biomedical image processing, that is medical imaging modalities. This topic is very important because it forms the foundation of how we visualize the human body internally without surgery. By the end of the session, you will clearly understand what is imaging, different modalities, physics behind each technique, and how they are used clinically. Let's start with a simple question. What is imaging? Imaging is nothing but mapping physical properties into an image. Mathematically, image is a function of energy interaction with the tissue. Very important insight is image is encoded physics. That means whatever image we see, it is not just a picture. It is actually physics information converted into a visual form. Example, X-ray. It has the attenuation of physics. MRI, magnetic resonance. So always remember, every image carries physics inside it. We Why do we have even need imaging? Because we cannot directly see inside the human body. We need imaging for two main purposes: structure, the anatomy, like bones and organs, functional, physiological activity. So the different diseases need different views of example. If I had a bone fracture, I need X-ray for the imaging purpose. And if I have a brain tumor, I need MRI. If I have a cancer activity, it uses the PET. So no single imaging method is enough for the all kind of diagnosis. Now let us think like engineers. Our goal is safe and accurate imaging. How do we achieve that? Each imaging modality is based on one physical interaction. There are four main interaction. Attenuation, it is X-ray and CT. Resonance means MRI. Reflection means ultrasound. Emission means PET and SPECT. So the chain is physics, modality and clinical applications. Very important line is each modality have the one physical interaction. Now we classify imaging modalities. Important point. Classification is based on interaction mechanism, not a device. So the transmission, it is the attenuation. We use X-ray and CT. For the reflection, ultrasound is used, and magnetic resonance is MRI, and emission is PET. So don't confuse it. It's not about the machines. It's about the physical behind them. Now let's go deeper into the X-ray core concept. Attenuation-based imaging. I equal to I naught e power minus 1s. It is the Beer-Lambert law. This meaning X-ray intensity decreases as it is passes through the tissues, depends on the density. So bone have the high attenuation, it appears white. Soft tissues have the low attenuation, it appears in gray. The limitation is poor soft tissue contrast. Important inside it, it produces 2D projection, it overlapping structures. Next one is CT. It's an extension of X-ray. Instead of one projection, it takes multiple projections from the different angles. This reconstructs the internal structure. The tomography is the slicing of the image. So X-ray is a 2D projection. CT is a cross-sectional slices. The advantage is better detail, no overlapping of the structures. And next one is MRI. It is the nuclear magnetic resonance. It uses photon density and relaxation. MRI works on a completely different principle. The nuclear magnetic resonance, omega equal to gamma p naught. This is the Larmor frequency, meaning photons align in a magnetic field. They absorb emit energy. MRI measures photon density plus relaxation time. So the signal comes from atomic level behavior. That's why MRI gives excellent of soft tissue contrast. MRI contrast depends on the relaxation. Two types of relaxation is there. One is T1 weighted fat. If the fat, it looks like a bright water, it look like a dark. T2 is a weighted. Here water is bright, fat is dark. So the mechanism controlled using TR and TE timing. T1 is used to anatomy, T2 is pathology. So doctor use both for diagnosis. Ultrasound uses sound waves. The acoustic impedance is equal to P rho C. When sound hits boundary, reflection occurs. So the more mismatched, stronger echo. So the example is fluid versus tissue. Strong reflection is created. Advantages: safe real-time imaging used in pregnancy scanning. Now, PET and SPECT, it is used for functional imaging. It has a tracer and it emits the gamma radiation. It detects the gamma radiation. Unlike others, it shows metabolic activity. Example, cancer cells have the high metabolism, so brighter spots are identified. It shows the function, not a structure. Very important comparison is structural imaging. We have to do structural imaging for X-ray and CT MRI, shows anatomy of the body. But we use spectrum spec for the functional imaging, shows the activity. So structures tells where the problems arise, function tells how active it is, like that. So all imaging systems follow the same model. There is a source, an interaction, and the detector and reconstruction. All modalities follow the same framework. No perfect imaging system exists. There are some trade-offs. Resolution versus safety, cost versus accuracy, like that. Examples, X-ray was cheap but low in detail. CT have a high resolution and high radiation. MRI no radiation, but it has high expensive. Ultrasound is safe and real-time effect. Every modality has its own pros and cons. Let's control different physics, different signals, different medical results. So always think the physics, modality, and where we use the application. No single modality is enough. So the combination gives the complete diagnosis. These are the references. Thank you.